Dr. Wallach, thanks for taking my call.
Yes, sir.
I'm calling for a friend who's got a 29-year-old son diagnosed with having a neoplasm of the cranial nerve. He later saw a specialist and was told that it was too small to operate, so they want to follow up every few months.
Okay. You say a neuroma?
Yeah, a neoplasm of the cranial nerve.
Okay, neoplasm. Okay, they didn't call it a neuroma. Okay. Yeah, neoplasm means tumor. Okay, cancer, neoplasm. Okay. And there's 12 pairs of cranial nerves. 12 come out on one side, 12 come out on the other side. And I'm amazed that they're saying it's too small to operate. Okay, because usually that's going to be the first thing. If they find a malignancy, they're going to take that sucker out, and there'll be side effects. So you take out that cranial nerve, it does things, okay? And so you'll lose a significant portion of, or maybe all of, the function of that nerve on that side. So, do you have any idea how much this young fellow weighs?
Yes, I have some more info for you. He's 5'6", weighs 218, and his last blood pressure was 163/99.
Okay, well, he's got high blood pressure. I'm assuming that's with medication. And also, he's overweight, he's obese. At 5'6", I'd like to see him weigh, for a guy, maybe 150. Okay, for even round numbers, so we're looking at 68, 70 pounds he needs to lose. All right. Shar, what would you give this young fella here, 29 years old, 5'6", 218 pounds, what would you give him for a small tumor? We don't know if it's the size of a pea or a grape. We don't know what's going on. We don't know which nerve it is. But he has high blood pressure, and he also has a neoplasm, a tumor on this cranial nerve. What would you give him to support his immune system and deal with the high blood pressure and also the obesity? Okay, Charmaine, again, this kid is 29 years old, 5'6", 60 pounds or so overweight. He's 218 pounds, and he has a neoplasm, a small tumor, too small, quote unquote, for the doctors to operate on. So what would you do for him?
Well, I would get him on a gluten-free diet. I would get him 2 healthy brain and heart packs. I'd get him the Daily Classic, the Niacin Plus, and the Cardio Sticks. And then I would also give him the Ocean's Gold, the Z-Radical, and the Immortalium. Okay, well, with the Ocean's Gold, why would you give him a thyroid supplement to somebody with a neoplasm who's overweight? Because it's got that sea cucumber? Sea cucumber in it, which is notorious for dealing with cancer. Yeah, it supports the immune system when people have cancer. Right. And, yeah, there's a wonderful, wonderful, I don't know, dozens of studies on it. And, of course, what would you do again for the weight loss? I'd give him the Rev. Rev, R-E-V. Yep. Right? I'd go ahead and get him 2 droppers full of that Rev, 2 bottles of the dropper bottles, so he can take a dropper full under his tongue 15 minutes before each meal. It absorbs oral tissues, and obviously take one before that, 30 minutes for each meal. The second one, 15 minutes for the meals. You can take 2 bottles a month, do that. And within a week to 10 days, he'll start losing a half a pound to 2 pounds a day. And the magic is he'll never gain the weight back as long as he stays on the 90 for Life program. And so also he'll slowly, the blood pressure should drop because this will support healthy blood pressure levels. And he can either gradually reduce his medication as his doctor has educated him to do, or if he's nervous about doing it himself, he can actually get the doctor to lower his medication. And then give us a call every couple of weeks, Alexander. Let us know this guy's weight. Let us know how his blood pressure is doing, and let us know what the doctors are saying about that.